All right, everyone, we're going to go ahead and get started. Welcome back from the Research Expo. I hope you guys were able to attend and hear all of the research that students across the country are doing. I know I personally was in Venus's room. If you got to have a chance to stop in there and hear a presentation on nutritional science and water intake, it was so interesting. And I'm sure all of the other presentations were lively as well. So yeah, I hope you guys had a good time hearing all those. And now I'm really excited to introduce our next speaker, Dr. Josh Trebach. He's a clinical instructor in the Ronald O. Perelman Department of Emergency Medicine at NYU's Grossman School of Medicine and medical toxicologist. He received his medical degree from Johns Hopkins University School of Medicine. You may know him from his very famous Twitter, at J. Trebach, where he tweets about his interests, including LGBTQ plus health, medical education, animal rescue, and toxicology. So please go ahead and welcome him as our next guest speaker for NPHC, and I'll hand it off to him to go ahead and present.
Well, thank you so much. Thank you so much. Let me pull up my presentation here. I'm very excited to be here. Let's see. So, confirm that you can see my screen. Everything looks okay?
Yes,
is that
we
correct?
can see it.
Wonderful, wonderful. All righty. So, hello, everyone. That was a very sweet introduction. My name is Josh Trebach. I'm an emergency physician and medical toxicologist. I actually recently graduated from NYU and moved a little bit to the Midwest. So I'm actually currently in Iowa City at a new place of employment. I am currently an emergency physician and medical toxicologist, and I love my job. I love my life, and I'm really excited to share with you sort of my career path and what made me go down these pathways, and just talk to you a little bit. Again, for the sake of just knowing things about me, I have gone straight through from undergrad to med school, to residency, to fellowship. So I've kind of gone straight through, so I can share my story with you and answer any questions you have. Trying to think about things. My pronouns are he and him, and I've been instructed that we're going to have questions saved until the end. But if you don't have time to have your question answered, which I think is unlikely, but if that ever happens, I'll list my Twitter. You can DM me any questions you have, and my email address where you can reach out to me as well. Okay. So I just want to say that I think this is really interesting because I didn't have anything like this when I was in college or when I was debating coming into the pre-health field. I didn't really have networking opportunities like this. And I really didn't even know what emergency medicine was or what toxicology was. I didn't even know I was going to end up in this field. Some people know that they are going to be a pediatric neurosurgeon from day one, but that was not my story. So allow me to share with you how I came to be here and answer any questions you have. Okay. So let's see if I can advance here. So before we start, I just want to learn a little bit about who's in the audience here. I can see the list of participants, and I know a general vague amount about the audience as a whole, but we do have some preformed questions just to help me tailor this talk a little bit more, depending on who's in the audience. So I think Sia might be helping me with that. Yeah, so they should be popping up on your screen, and you can just answer these questions here. Well, this is so fun. I can see them like in live time. All right, so we kind of have the coasts are representing, it seems. But now that I represent the Midwest, I have to play some favorites towards the Midwest. But okay, cool. And we have some people outside of the United States as well, about 10%. Wonderful. All right. We can move to the next question. Perfect. Let's see. Yeah, so this is what topics are you hoping to learn the most about during this presentation? Again, I can talk a lot about emergency medicine, and I'm planning to talk about medical toxicology as well. every now and then people ask me about medical education, and sometimes people want to hear basically about social media and how to be someone in healthcare on social media during 2022 and onward. So happy to talk about anything, but I can, of course, tailor it to be whatever anyone wants. And if you see something that's not on this list, you can always type it in the chat. I can read the chat and present at the same time. I'm pretty good at this. Now that I said that, though, I'm probably going to mess something up. Okay. All right. Cool. It seems like a lot of people want to hear about emergency medicine and medical toxicology. We'll throw in a splash of medical education and social media as well. Okay. Sounds good. And I think there's just one more question. Please, I think this is really important, only because not everyone has very easy avenues to be able to ask people questions. And my personal sort of policy is that I'd prefer people to ask questions that they were concerned about or things that they were dwelling over in the back of their heads. Just ask it up front. I'll be honest with you. If I can answer your question, absolutely. If not, I may have you shoot me an email so I can put you in touch with someone who can. Okay. Wonderful. A lot of yeses. I like that. Not a single person said no. How wonderful. All right. So with that being done, I think we can go ahead and move on to the talk. Okay. So mandatory things I have to say. I have no financial disclosures. No one's giving me a large check for doing this to make sure I say a certain thing about a certain school or anything like that. And nothing I say here reflects my current employer, my prior employer, any of the institutions I've worked for now or previously. All right, this is all me. This is all Josh's. This is my mind that you all are gonna, unfortunately, have to hear. All right, so here's our objectives today. I don't like getting too fancy. I just say what it is. So we're going to discuss a career in emergency medicine, discuss a career in toxicology, specifically medical toxicology. We are going to talk a teeny bit about being a healthcare professional on social media. And then I'm also going to talk a little bit about medical education, hence our poll that we just did, and anything else that decides to come up. Again, we're going to have a little bit of time, and I want to make sure that we get questions answered, okay? And if you're the type of person who doesn't like to have your question answered on a public forum, like in front of everybody, again, my DMs on Twitter are open. You can ask me questions. My email's at the end. I saw someone in the chat ask about Instagram. I am not good at Instagram for many reasons. So that might not be the best avenue to contact me. I get notification fatigue, so I can kind of stick with my email and Twitter. So those are probably going to be the best ways to reach me if you have questions. All right, so emergency medicine. I think a lot of us know what an emergency room or an emergency department is, but what is emergency medicine? And I'll be honest, I didn't really know what this was when I was in college and just starting out in medical school. I knew a lot of things about emergency medicine, like the stereotypes, if I'm being honest. And I knew that people came to the emergency department for emergencies, hence emergency physicians and emergency medicine healthcare professionals worked in the emergency department. It's kind of all I knew. Now, when I was in college and even the very beginning of med school, I had these stereotypes about emergency medicine that I'll admit originally pushed me perhaps a little bit away from the field. I remember thinking like, oh, you have to be some sort of bungee jumping lover who loves adrenaline and can't sit still. And that's the type of person who has to go into emergency medicine. Everyone who's in emergency medicine is like super outdoorsy and, camps outside during an ice storm and, risk taker, drives their motorcycle to and from work and takes a super complicated route on purpose. And I was like, man, I don't know if that's kind of my style. And I realized that those were just conventional beliefs and stereotypes that I had held on to. And I'm very glad that I decided to challenge those, because I didn't have something like this where I could hear someone talk to me about this sort of stuff. I just sort of took a gamble, and I remember exploring the emergency medicine field, and I was like, oh, this is completely different. And I had to challenge my own preconceived notions. So what I'm going to tell you is that the reason I like emergency medicine is because it's a very nice blend of the two different sort of mindsets in medicine. So people will often say, if you're debating what you want to go into, oh, do you want to go into something like surgical or medicine? And I always thought that was funny. I must have been asked that question like hundreds of times, I'd say. People like surgery, like cardiothoracic surgery, neurosurgery, that cerebral aspect of some things like internal medicine. So it's this nice combination of both. And I find that's really, really appealing. And for me, when I asked myself what it meant to be in the healthcare field, for me, that meant being able to be someone who can help in any situation. So I loved the idea of being able to help in the emergency department, or help in the airport, or help if I'm at the grocery store, or, I wanted to be able to, if you're a pediatric patient, if you're an adult patient, I wanted to be able to do sort of it all. And so that's sort of what got me thinking about emergency medicine. And when I started to see that these stereotypes I held on to weren't necessarily true, I mean, certainly one of my great friends does all of those things that I just mentioned. And I love seeing the pictures on his phone, and that's it. Like, I'm like, that's not really my style, but I'm happy for you. So with that in mind, it's a nice fusion of these two sort of realms. And what I'd like to do is run through some of the pros and cons, just to be completely transparent about emergency medicine, because I wish someone had done this for me when I was in their shoes. Now, the obvious bias here is that I am an emergency medicine doc and I love it. So I'm going to do my best to give you both sides of the coin here, okay? So the emergency department is fast-paced. People are doing something called task switching frequently, which is going from one task to the other, constantly back and forth. And sometimes it's not just 2 tasks, it's 5 or 20 or 30 tasks, right? And for some people, that's really fun. I think if you are someone that finds yourself not being super frustrated if you're working and then your phone dings and you have to check your notifications, and you do that, and then you check something else, and then you got something in the microwave, and then also you're like petting your cat at the same time. You're doing a bunch of different things, and that's okay with you. I think that emergency medicine can flow with that type of personality. And for me, I remember the first time I was in the emergency department, I was like, wow, time is flying by. And on all my other rotations in medical school, I remember thinking, wow, this is really cool, but it doesn't really make the time fly by. And for me, emergency medicine was the first time where I was like, oh my gosh, it's been 12 hours already? What? So it was really, really cool to see. Now, some people I know, because I've worked with some people who rotate through the emergency department from other specialties and other services and things like that, who don't necessarily love this about emergency medicine. They say it can be exhausting to have to constantly get interrupted in the middle of one task. And, I hear you. If you're reading about a patient's complex history and then have to run and do something like an emergency just happened, that can be a little bit frustrating to be pulled away from something when you were so absorbed in it. But that's one of the things you have to ask yourself about emergency medicine, because there's a lot of task switching in emergency medicine. Now, I'm a big puzzle guy. I love puzzles. And I think one of the coolest things about emergency medicine is the undifferentiated patient. So patients walk in, sometimes they know their name, sometimes they know their medical history, sometimes they know nothing, sometimes they can't talk, sometimes there's a lot of different barriers. And so you don't always know the information up front. So emergency medicine is one of the fields of medicine where you truly get an undifferentiated patient. And I find that very intellectually very satisfying. I love being able to start from nothing and being able to build my sort of story, build my relationship with that patient, understand them, figure out what's going on. I find that very, very fun and challenging, and it's something that keeps me going. Now, certainly, this doesn't appeal to everyone. Again, this is a pro for me. It could be a con for some other people. Some people don't necessarily like that a patient can come in and not know all their medical history. Sometimes people want to know more about what happened. Well, what drugs do you have in the home? What medications are you on? Where were you before this happened? Sometimes you're not going to get anything, and that can be frustrating for some people. I even know I've seen the frustration of sometimes having a patient be like, oh, all my records are at another hospital. And that being frustrating to some people because you don't have that. So in emergency medicine, you're truly starting sometimes with nothing. And there's a lot of a lot of figuring the puzzle out that you have to do. And again, for me, that's very enjoyable. And I understand, though, that's not everyone's cup of tea. This is just to get y'all thinking about what emergency medicine is and what you can expect. So sometimes you are navigating in the dark, and not everybody likes that. I've definitely had questions from the doctors in the hospital. They're asking me like 5 questions in a row about the patient. Well, where were they before this? Or how many times did they say they did this? And I'm like, I don't know. I don't know. I don't know. They don't know. We don't know. I'm sorry. It can be a little frustrating. I hear that, but there's something nice about starting truly with the undifferentiated patient. So the puzzle aspect, I think, is very appealing. Now, there are tons of opportunities for training within emergency medicine. There's something called fellowships, which are additional training that you can do from the field of emergency medicine into another field. So for example, you can do a global health fellowship after completing your emergency medicine training and go on and become a global health / emergency doctor or global health emergency professional. And there's a lot of different fellowships out there. Now, depending on which avenue you go through, some fellowships exist and some don't. Strictly in terms of, for those interested in becoming a physician, this is sort of my experience. I can speak on the fellowships, and I have a screen later on of the different fellowships that are available in emergency medicine for physician trainees and people wanting to apply afterwards, which we can talk about. Now, there's no real cons to this. It's just more time that you spend in training. But what's nice is that it lets you develop a niche in whatever it is that you're interested in. So for example, that's actually how I became trained as a medical toxicologist, simply because of this fellowship. Certainly I had an interest in medical school and residency, but I was able to fully dive into that during fellowship. And we'll talk more about fellowships later, but there is a lot that you can do with emergency medicine. And then there's also, you can choose not to do a fellowship and just practice emergency medicine. And we'll talk about some of the career opportunities in a little bit as well. Personally, I love the community aspect of emergency medicine. I find it very rewarding to be able to serve the local community of the place you live and the people around you. I find it to be a great privilege and an honor to be able to take care of the people who live in your community and the people who visit that community from somewhere else. So in addition to taking care of that patients or that community and those patients, I find you also build a strong community with the people you work with. There is something about there, you build a lot of camaraderie working alongside the PAs, NPs, the nurses, the residents, everyone, if you're running a code at 3 a.m. for the second night in a row. And I find that camaraderie I've built has been very rewarding in terms of keeping up with some of the energy that can be going on in the emergency department. So I very much love the community, and that's both with the people you're working with in the emergency department and the community that you're serving. So it's quite an honor, truly, to be able to do that. Just a couple more points I'll tell you about emergency medicine. One is the shift work aspect. Now, some people love this and some people hate this. Some ER doctors hate this. So it's quite variable, but I'll tell you that when you're on, you're on. So if your shift is from 7 a.m. till 4 p.m., 3 p.m., 4 p.m., then from those hours, those 8 or 9 hours that you're working, you are on. You are running that, you're doing that sprint. However, after you're done, you're done. You don't necessarily have to take your work home with you. Granted, you still have to write your notes and do your charting, but you're not getting, if you're in an emergency healthcare provider and you live of course, if you live at home, you go to work, you come home, and then you're done. People really much like that aspect. I will tell you, though, that the shift work aspect can be a little bit challenging if you're bouncing around from days to nights. No one, unless you've been working for an extremely long time and have a really sweet setup, no one's only working the morning shift once a week. You're sometimes bouncing out between your mornings and your days and your evenings and your weekends and your holidays. It's a little bit challenging. And so that shift work sometimes is really appealing to people because they know when they're going to be available. However, it can also be less appealing in that you're working nights, you're missing out on different events or holidays just because, your friend's birthday party is on Saturday. but they're not going to have the birthday party at 7 a.m. for when you get off work. They're going to do it during the day when you're working or something like that. So there's some pros and cons with that, which again, I'm happy to answer any questions about. And the last thing I want to discuss is that you're seeing people in the emergency department on the hardest day or one of the hardest days of their lives. This isn't, when I go to see my primary doctor because I need a refill on my allergy medicine because I'm allergic to my own cats, which is another story. It's kind of not a big deal for me. I kind of go in there, I say, hey, I need my allergy meds, and then that's it. People don't necessarily go to the emergency department for that. They go there because they have no other option. They go there because it's an emergency, and they go there because something is happening that caused them to go there. No one wakes up and says, I think I'm just going to stroll into the emergency department today. So you're seeing people at a time that can be very, very challenging for them. And it's a privilege. Like I said, there's a lot of honor it's the privilege that comes with being able to take care of someone like that. However, it can be exhausting. And I've heard some people explain that they've suffered from empathy fatigue, just, even during times like a pandemic, such as the one we're in right now, where so many people are sick, you're talking to families, you're seeing a lot of sadness and people struggling. And that is something you have to consider, that you are seeing people potentially on one of the worst days of their lives. I've been to the emergency department once in my life, and I remember that very vividly. And I think a lot of people who have been to the emergency department will remember that. I went there as a patient. I should rephrase. I've been to the emergency department many times for work. I've been there once as a patient. So just keep that in mind, that sometimes it can be very challenging from that aspect. So overall, emergency medicine appealed to me because of all of those things. I found a lot of joy in stimulation, and just something I wanted to do. I felt like it fit with everything that I felt about medicine. So this is the path I took to emergency medicine here. I completed my undergraduate training. I will say this, I don't think it matters as much where you go for undergrad as much as what you do there. There's a whole other talk you can do on preparing your resume or whatever for before medical school applications. And I will tell you, I went to Virginia Tech for undergrad, which wasn't necessarily a school known for its ability to be tons of pre-med people. That wasn't something we were known for when I was there at the time. It was more of a big engineering school, but I was at Virginia Tech. I went to Johns Hopkins for my medical school training and then stayed on for my residency training. And again, if anyone has any questions about extracurriculars or their applications or whatever, I was on the admissions committee at Hopkins during my time there for a little bit. So I do know a little bit about, reading applications or reading personal statements and things like that, and happy to field or answer any questions that you have just based off of those experiences. So what I did is I completed my undergrad. That was 4 years. I went through 4 years of medical school training. I rotated through all the services, applied into emergency medicine, and matched into an emergency medicine residency program, which was a 4-year program. Now, the brief aside I will make about this, and again, happy to dive into this if anyone has further questions, but emergency medicine residency programs are anywhere from 3 to 4 years, and they vary. Sometimes the 4th year, in some places, just an extra year of just doing more stuff as a resident. Other times, like where I went for residency, it's kind of a time to focus on something niche or something that you're interested in while you're working as a resident in the emergency department. There is a lot of discussion right now in the EM world, the emergency medicine world, about if more programs are going to be moving to a 4-year program. But right now there are 3-year programs and there are 4-year programs. I applied to both. I know great doctors from both 3-year and 4-year programs. It's sort of what fits what you're interested in, which is a program specific thing. So you got to do some investigating. Then after I graduate, I'm officially a emergency medicine doc, passed my boards, and that was that. Now, from there, you can choose the two big categories of jobs in emergency medicine are what people say community doctors and academic doctors. Now, please note that there's a ton of overlap between these two, and people like to make this distinction as if it's very black and white, but that's not the case. There is a ton of overlap. You can be a community doctor, which means you work in the community emergency departments. So you're usually not at a big ivory tower place like Hopkins or Harvard or something like that. You you go to work, you do your shifts, you come home. You might be involved in a few projects here or there, but those are your main responsibilities. That's what people like to traditionally sell community as. People like to sell academic as you go to work, you do your shifts, you come home, you do your research, you work on papers, you do teaching, you work with the medical school, you get involved in projects and grants and do a bunch of other stuff. Perhaps, all while you're working your shifts and scheduling that out. So it's people like to make those two sort of separate camps. There is a ton of overlap. You can be an academic site for your research and work in the community. You can be a community doctor who does a ton of research. You can be a PA that works at a ivory tower sort of hospital and then be on a couple different research projects and working along that. It's not super clear cut. It's just, again, what your own interests are. And I think as you if this is a career you're interested in, as you get more into the weeds of emergency medicine, you'll start to see where you like to be, what interests you. I personally have known that I've always liked education. I like teaching, and I do like research, and I love the world of emergency medicine and academia. So that's certainly where my job is currently, but I have friends who I train with and respect tremendously who are out in the community and they love it too. So it's just a matter of what fits well for you. And again, happy to talk more about that. So fellowship opportunities, I said I was going to come back to. So fellowship opportunities, there are a lot of them. Here's just a list of a decent amount, and I don't think all of them, but these are just the different opportunities in emergency medicine, things like wilderness medicine, which I think is really cool, toxicology, which is what I did, medical toxicology, people who are interested in global health, palliative care, medical education. There's a ton of stuff out there that you can choose to specialize or fellowship in. Some of these are 1 year, some like toxicology were actually 2 years. So I think for some people after doing a 4-year residency, the thought of doing another year or two of training was not appealing, but I loved every second of my fellowship. It was a blast. And I got to learn all about toxicology, which was right up my alley. So it was very, very exciting. So again, as far as these fellowships go, you don't have to apply to this right after residency like I did. Some people actually will work for a little bit and then decide, hey, you know what, I'm really interested and I want to do an ultrasound fellowship. Go back to being, go from an attending to a fellow, which is okay, and do that training. And then you can go back to whatever you were doing. It's really cool. And I've known people who have come straight out of residency and gone into fellowship, and then people who have gone from being in the community or at an academic site or wherever, and then decide they want to do fellowship. There's no rules that say what you have to do. Okay, it's kind of fun. Now, I want to make sure I leave time for questions. I'm being cognizant of the time here, but I do want to talk a little bit about medical toxicology. For those of you who happen to be aware of my Twitter, you know that I love toxicology. I love it for the more than just the mysteries and the plants and the mushrooms. I think there's a lot with medical toxicology that's really, really, really cool. I will say this, that you don't have to be an emergency doctor before doing medical toxicology fellowship. For example, there are people who have done pediatrics or psychiatry and then gone to study medical toxicology fellowship. So, but I'm just sort of sharing with you my journey here. And so medical toxicology is something that I did after my 4-year residency program. And I did that up in New York. Now, when people think of medical toxicology, they think of things like, magic mushrooms, which this is not. This is an Amanita mushroom, Amanita muscaria, and think about poisonous mushrooms. However, toxicology is a little bit more than that. So I just told you sort of what I did here is that I just sort of added the tox fellowship on and then trained and then became a toxicologist. But I want to share with you what being a medical toxicologist is. So certainly it is the plants and the mushrooms, and the murder mysteries and some of the cool things that people might see if I sometimes post too much of that on Twitter, so I apologize. But it is some of the cool parts about toxicology. However, it's also marine tox. There's a lot of nastiness that lives in the ocean and a lot of things that can hurt people. It is also just pharmaceuticals and medications, there are constantly new drugs coming out. And these are something that we need to familiarize ourselves with. If you've ever called poison control, we work closely, toxicologists work closely with poison control to make sure that the community and people are being safe. And if they're not, finding ways to direct them to the hospital. Disaster medicine actually has a play-in with medical toxicology as well. Simply, if you think about bombs and radiation and toxic gases, I mean, these are things that I've actually been called about and consulted before because this is such a unique sort of thing. And the area that I've studied allows me to be prepared to answer questions that people may have about a patient. And so it's a very, for me, I think it's just a very fascinating field. And I remember in medical school and even in college, I don't know if many of you will have this same sort of mindset, but my favorite thing was just the pathophysiology. I loved learning how things ticked, how things worked. And toxicology is just all of that. So I know sometimes toxicologists can scare people off by showing like these big, horrible diagrams of like the Krebs cycle, which like you burned out of your brain like as soon as you learned it, or glycolysis and all these other things. But knowing some of that, you can understand how a toxic gas reacts with something else to form something that precipitates in your lungs and causes lung injury. And it's very cool to understand how everything works. And toxicology is really big on pathophysiology, and that's for me why it's so much fun. I just find it very, very intellectually stimulating. And so yes, tons that you can do with toxicology. I think people especially over the more recent years, have come into realize that addiction medicine, people dealing with substance use disorder, alcohol use disorder, is a really a big issue that we need to continuously address. And whether that's at a hospital level or a patient level or at a public health level, there's a lot that we can do as toxicologists to continue to get involved and make sure that our community is supported and that people are getting the help that they need. So again, a lot of avenues here. Perhaps lastly, I'll throw on that there is a historical component as well in toxicology. Sometimes we learn about expired drugs, things that no one makes anymore, but people could certainly still have in their house or their basement, or like your grandma has under the sink for like 900 years because no one threw it away, and then the kid gets into it. There's a lot of stuff we have to learn about. So there is a historical component about toxicology to making sure that things that we don't forget the toxicological tragedies of the past, so that we can protect patients in the present and the future. So my current life right now is I am an emergency doctor, emergency medicine physician. I work in the emergency department. I work alongside residents. I take care of patients. When I'm not doing that, I work as a medical toxicologist. I just recently moved to the Midwest, and so I'm beginning my job here where I will work with our poison centers. I'll be a consultant for the hospital when I'm not working in the emergency department. And then all while doing that, I'll be teaching medical students, residents, PAs, NPs, anyone who wants to listen to me ramble on. And so that's my current life. And it's really what I wanted. And I didn't know any of this was a thing when I was in your shoes. And so that's what I want to show you here, is that there is always, you can find what it is you want to do in medicine, even if you're intimidated by the stereotypes of a certain specialty, or if you don't even know something like that exists out there. I was worried. I remember rotating through all the specialties, and I was like, surgery is really cool, but I get a little bit bored. And then I was like, man, neurology is super interesting, but like, something doesn't feel like it's something I want to do forever. And then I realized that other people felt like me, and there it is in emergency medicine. So I hope that was able to explain a little bit to people about those fields and how I got into them. A brief thing, actually, before we talk about this, I wanted to talk about medical education. So when I showed you the list of fellowship, medical education is a fellowship people can do, not just after emergency medicine, but other fields as well, where you can do a specialized fellowship in how to teach and how to assess and evaluate people within medicine and your teaching. This could be residents, this could be medical students, this could be PAs, this could be NPs, it could be college students. I guess it could be anyone who you want to teach medicine to, and that's something that people can actually choose to specialize in. Alternatively, That doesn't mean you can only teach if you've done a medical education fellowship. It's just a little bit more rigorous and a bit more of a higher standard. And so if one of my colleagues who did a medical education fellowship is very interested in being a program director of a residency program. That's something they're very, very interested in. And I think they're going to be great at that. But they wanted to learn all the ins and outs and how to assess people and do research and education. And I think it's been very beneficial for them. Now, like I said, that doesn't mean you can't teach unless you've done a medical education fellowship. I personally have not done a med ed fellowship, but I do love teaching. I love education, and that's something that I'm passionate about. So I know by the earlier poll, not everyone wanted to hear a lot about social media. So I'll do a quick spiel that on social media, there is wonderful avenues for teaching and medical education. That's actually the reason I started my Twitter. I didn't start a Twitter because I wanted to tweet to everyone about toxicology. I actually started a Twitter because I saw that there was a lot of emergency doctors on there showing pictures of cool ultrasounds or cool EKGs or cool teaching pearls. And I was like this semi-anonymous account where I was like, I'm not going to like even have a profile picture. I'm just going to lurk. And it was great. I learned a lot about emergency medicine. And then as I slowly started to build that community on social media, specifically Twitter, sort of when I became somebody who tweeted a little bit more about things that I found interesting, got more into tweeting about toxicology, and then things sort of took off from there. As far as being a healthcare professional on social media in 2022 and onward, I will say this: just ask yourself what it is your goal is for being on social media at the time. I think there's a lot of things out there. It's great for networking opportunities. I've met a ton of people on social media, people that I've met in real life, people that have collaborated with on projects, people who I've even interviewed with for jobs have come from social media. So it's great for networking. It's been great for learning, as I mentioned, for things like ultrasounds, EKGs, especially in emergency medicine. I know that pathology Twitter is really wild with their images. They love their pink and purple pathology images. So I think that's really cool as well. So you have to ask yourself what you're interested in. There is a good sense of camaraderie too, to hear about your other colleagues. I know during COVID, a lot of ER docs on Twitter were expressing their struggles and how it was for them. And I think a lot of people took solace in that. And yeah, so I think the big things, if I were to have some rules for social media that I hold myself to, it's one is always familiarize yourself with the social media policy of wherever you work. Whenever I get a job or a new employer, I always ask, hey, what's your social media policy? Like, do I need to have a disclaimer in my bio? Is this okay? Just because I don't want to be breaking any rules or getting other people in trouble or, violating things that are specifically specified against. Don't post patient information. Doesn't seem like it should be said, but unfortunately, I will see things on social media and I'm like, that shouldn't be up there. It can be a little bit, it's not just unethical, it can be like dangerous for the patient as well. So I don't think more needs to be said about that. Just don't post patient information. If a patient can see something you post and know it's about them, then it probably shouldn't be posted. You should always be cordial and be reasonable. Those are just sort of my takeaway tips. I understand people interpret those differently, but those are sort of what I hold myself to. And that's briefly what I'll say, unless anyone wants to hear more about that. So thank you all for my talk. I understand I went probably a teeny bit long. There's my Twitter handle on the left, at @Trebach. There's my email if you have any questions at all. And I'm always trying to see how people like hearing me or not like hearing me ramble and talk. And so if you wouldn't mind, here's the QR code. I think someone's going to throw the link in the chat, but just so you can fill out a little survey about if you found something interesting, or if you want to leave a comment for me saying something that worked really, really well, or something you really hated, you hate my tie, something like that, that's fine. Just let me know, and I am happy to take any questions, okay? Thank you so much.
Yeah, we'll go ahead and get started with the Q&A section now. If you have any questions, please go ahead and put them in the Q&A. We'll go through all of them and upvote the ones that you like, because we'll go through based on which ones have the most upvotes.
Right.
And if you would like to say your question out loud, you can raise your hand and I'll call on you and let you talk to Dr. Trebach directly. So first up, our first question is, EM is becoming highly competitive because of its appeal to work-life balance. However, how do physicians combat burnout in this specialty?
Yeah, so that's a great question. Being open and honest, I know people who have been practicing emergency medicine for less than 5 or 6 years and are kind of already a little bit fatigued. I think just because bouncing around from days to nights in the middle of a pandemic can be quite exhausting. So uh, I think the best way to combat the burnout is to find a way to keep you loving your job and to keep yourself curious or stimulated. That's personally the answer that I go to. And for me, that's balancing it with toxicology and teaching. Again, I love emergency medicine, but I think if I were to only do that 24/7, I might not have the global satisfaction that I do with my current setup. And again, that it's just completely different for different people. Some people say, "Oh, I just want to work in like 3 different EDs to keep it mixed up." And some people do that, right? Other people say, "Hey, the best thing for me would be to work the exact same shifts at the exact same time every week." And so I know someone who personally just does 2 or 3 overnights a week, the same days, and that works well for them, right? They just do like 2 or 3 overnights, the same days every single week. And so they're able to keep some consistency. Other people just love the chaos and the bouncing around. So you kind of have to define what works for you, but to ignore it and pretend like getting fatigued or tired is never going to happen could be a little bit dangerous. Granted, it doesn't happen for some people, I imagine, but just like any other field, surgery, internal medicine, whatever, you got to find a way to keep yourself curious and intellectually stimulated, as I say. I hope that helps.
Yeah, great answer. Next up, we have another question. Emergency medicine seems like a really exciting specialty with lots of variety on what you see from day to day. But does it ever bother you not being able to follow your patient's recovery from start to finish, like you do in some other specialties?
Yeah. So I feel like I'm gonna make up a number here, but I feel like if you ask 10 ER docs, how many of you like will check on patients either in the chart or in person if possible, but usually follow them on the chart to see what happens, to see if you were right or wrong about something or to see how they're doing. I'd say maybe like 9 out of 10 would say they do. Simply because if they're in a hospital system where you can follow them on like electronically, you can see how they're doing, and a lot of us like doing that. I think personally that's how you learn and get better. If I thought someone had pneumonia, and it turns out that after they got admitted they did this huge workup and it was actually some sort of autoimmune disease, I would be like, oh man, like I learned something, right? So it can be a little bit sad when I see a patient and then I build a rapport with them and then they're whisked away to the inpatient world, but nothing's stopping you from being able to see that patient, especially unless, if you transfer them out and they're never going to be seen again, like you're in a tiny emergency department and you have to transfer all your patients, it might be a little bit more challenging. But I've received calls from doctors before being like, hey, I just want to check on my patient, see how I saw them in the emergency department last night. I want to see how they're doing. And so there are avenues to do that. But I definitely think about my patients that have been admitted days later, and that's what makes me check on them. And some of these softwares that we use, like Epic, lets you save a list of your patients, and so you can keep track of how they're doing. Because it's nice to know that.
Yeah, for sure. Okay, next up we have, what did you look for in undergrad's application to medical school? Shadowing, internship, jobs, clubs, etc.
Yeah. I think the biggest thing that stood out to me was whenever I interviewed people, I would always ask to, because y'all would totally outcompete me if I was your classmate now. So I can't I don't think I can hold myself against anyone here. But the thing I would always see is these big applications. Everyone's got a bunch of things. I think what always stood out to me was when someone's passion shined through. And so the way I would do that is when I was interviewing, I would say, look, your application has a ton of things on it. This is great. But if you had to choose one that was like the most impactful for you, what would that be? And I think, for me, when I was in college, I volunteered at a suicide hotline, a crisis hotline. And that was something that was probably the most impactful thing I ever did in undergrad. And it really stuck with me. And I wonder if the reason I have that question, I wonder if someone asked me that in one of my interviews and I really liked it. I'm trying to remember, but I find that doing something you're passionate about, if someone says, yeah, I like go to this clinic like once a week, and I'm like, oh, how is it? And they're like, oh, it's cool. I'm like I don't like, I'd rather you say like, oh, I'm in a band and music is very therapeutic, and we have tried to find ways to be able to do concerts for the children's hospital or something. I don't know, like I think finding something you're passionate about and being able to incorporate that is I think that speaks a lot, because that's what you want to be doing, right? And I want people to be able to be successful and enjoy what they're doing, right? If you secretly hated being at the free clinic and secretly hated volunteering and secretly hated being in the research lab, I don't think you're going to enjoy if people come in expecting you to want to keep doing that when you're admitted into medical school. So there wasn't like a single activity that I looked at and said, absolutely, we got to take this person because they had this research project or something. No, for me, it was trying to see that passion or that dedication shine through. And for what it's worth, not everyone's going to be able to have the bandwidth or the time to do a bunch of activities, and that's okay. If someone says, look, like, I've seen applications where someone had one thing they did outside of school because that's what they could do, right? Sometimes people also have to work to put themselves through college, right? Like, I think we have to remind ourselves that it's such a privilege to be able to not have to work for money while you're in college. And some people have to, I remember I remember talking with someone, and they were telling me the thing that they were most passionate about was their work, their job they did outside of school, because that is what kept them in school. And I was like, you know what? Like, I respect that. I completely appreciate that. So I think that assuming that everyone has to have like 9,000 extracurriculars and 30,000 pre-health committees and like is not correct. Granted, I am no longer on any admissions committees. I have no power. But that's just me. And some people may agree with that. Some people disagree with that. But at the end of the day, the thing I look for is something that someone is passionate about, which can be anything.
Yeah, I think we have time for one more question. So, and this one is, with public trust in science and medicine at an all-time low, how do you work to combat misinformation in your field on social media?
Yeah. If you figure that out, let me know. But realistically, I think that's a really challenging question. And I think, I've had my own family members reach out to me and ask, hey, like, is this true? Or I heard about this, or, combining, should I take this with this? Is that dangerous for me? Sometimes they're toxicologically themed, and that's easy for me to answer. Sometimes it's, people are victims of misinformation. And my personal approach is that most people, I don't think are, and this is my opinion, this is my personal opinion, is that most people aren't spreading misinformation or eating up misinformation because of ill will. I think people are vulnerable, and people want answers, and people have questions they want answers to. And I will consistently strive to point people to what I believe to be reputable sources, or I will point out if I think something is an inappropriate source of information. But it's quite challenging, because if someone has already made up in their mind that they are going to believe their friend on Facebook over the medical toxicologist who posts memes on Twitter, it's kind of a lost battle already. And so it's really, really challenging. And I think what makes it more challenging is that you have all sorts of healthcare professionals on Twitter or in social media, as I'm sure we've all seen, who continue to play into this misinformation. So I don't think there is a super easy solution or super easy answer. I think my personal approach is I just continue to always be honest. I will, if people ask me a question about if something's reliable or not, I will point them to the right answer. I will explain myself, but I don't delve in the arguments and the name calling and the that find that sort of behavior not to be conducive. And if someone's resorting to calling you names, it doesn't sound like they're going to respect your opinion. And so I usually disengage from the conversation at that point. But you will find people who are interested in learning more, in who have built up their faith in certain aspects of the medical community. And so from my personal experience with my family, a lot of my family have reached out to my partner and I just because of our combined expertise with a lot of some of this stuff. But it totally depends. And I apologize. I wish there was a better answer, but this is unfortunately might be the worst era of medical misinformation on the internet that we've seen in quite some time. And so looking for more solutions and answers as they come up. Kind of a sad note to end on. I'm sorry, everyone.
It's okay, because we'll do one more question.
Okay.
So we won't have to end like that.
Yeah.
For our last question for real this time, do you choose your hours with emergency medicine or are you given a fixed schedule?
Yeah, great question. So I want to answer your question as best I can. So give me 4 seconds to think about every place I've worked. Hold on. Okay. So I have, you almost always get to have some sort of input into your schedule. And at some places that the amount of input you have increases with seniority. For example, if at my new job, I said, hey there, I don't really like nighttime, so I don't want to work at nighttime. Probably wouldn't fly. But if I said, hey, like next week, my oh gosh, what's a good reason? My husband and I, it's our anniversary. We want to have off that day. Totally reasonable. Like that wouldn't be an issue, right? So you have some wiggle room to be able to do what you want, which is nice. But making hard demands on your schedule are tough unless they're negotiated up front in your contract. Like I said, if someone has in their contract, they're only going to do 3 nights a week, Monday, Tuesday, Wednesday, that's what they do. But for me and a lot of my colleagues, and thinking about all the places I've worked, I usually have some say, but I don't have all of the say. So I can't say I never want to work ever on the weekend, ever. And I want every Friday off. And every night there's a new episode of Grey's Anatomy I have to have off. Like you can't do that. But I mean, I have a lot to catch up on Grey's Anatomy on Netflix though. So I have a lot of, it's less of a concern for me. All right. So I hope that answered your question. I know that we're out of time. So if anyone has anything at all, Twitter DMs, email, and either of those are great places to reach me. And then if you please wouldn't mind filling out just a little survey so you can tell me how much you liked or didn't like me, that would be fantastic. Thank you all very much for your time. I really, really appreciate it. Best of luck to everyone moving forward. I know it can kind of seem a little bit demotivating, disenchanting right now in the world, given COVID and how many of us in healthcare are struggling, nursing shortage, et cetera. But I will tell you that there's a strong sense of camaraderie that I have with a lot of my colleagues. And if this is something you're interested in, you should continue to pursue it. All right. Thank you so much, everyone.
Yeah, thank you so much, Dr. Trebach. It was such a good presentation. I think everyone truly learned a lot. And it was such a pleasure to have you as a guest speaker.
Thank you.
Next up, we have a presentation by Dr. Henderson on the day in the life of a cardiothoracic anesthesiologist. So if that's something you're interested in, please head on over to the lobby and join that next session. So thank you so much, everyone, for attending.
Thanks, everyone. Thank you, Sia.